Common confusion in MRCPCH candidates appearing for the theory exam, the FOP test, especially the AKP exams, is confusing between nephrotic and nephritic syndromes and getting mixed up between the features and complications. So what are the typical features? So we are giving some golden nuggets today for typical questions which are asked in the MRCPCH regarding the theory exams for differentiating nephrotic and nephritic syndrome. And I can guarantee that after this, you will not get confused between the two. So first is the complications. So what does confuse people? So for a child with nephrotic syndrome followed by headache, one of the choices is given hypertensive encephalopathy and the other is CVST or cerebral venous sinus thrombosis. Usually in a nephrotic syndrome presenting with severe headache, always think of the right choice, which is cerebral venous sinus thrombosis, not hypertensive encephalopathy. Number one question which is asked, which causes confusion. Number two, type 2 the streptococcal glomerulonephritis is a type 3, is not a type 3 hypersensitivity, it is a type 2 hypersensitivity. And this is quite commonly confused in the exam. Also, in post-streptococcal glomerulonephritis, C3 will become low and then recover later on. Now in the exam, to have a clear idea, think of nephrotic is equal to massive proteinuria plus low albumin and edema. So that is, and that complication is thrombosis plus infection. Whereas in nephritic, think of it as a presenting with hematuria, hypertension and oliguria. So think of it as an immune complex glomerulonephritis. Most important differentiate between the two is timing. IgA nephropathy has hematuria within 2 to 3 days of upper respiratory tract infection, whereas post-streptococcal glomerulonephritis hematuria occurs about 1 to 2 weeks after throat infection and 3 to 6 weeks after skin infection. And always match the headache question, always think of the severe new headache in a nephrotic child, always repeating cerebral venous sinus thrombosis. Do not think of steroid-resistant disease or don't be distracted by that. Hope this helps. If you find this content useful, please share with your colleagues and please subscribe. Till next time.